briefly, I'm providing an overview of the webinar for the oral health request for proposals. First, I will give a brief overview of the Connecticut Health Foundation, especially for those people that are not familiar with the Foundation's work. And then we'll get into an overview of the request for proposals grant opportunity. So the Connecticut Health Foundation is the state's largest health philanthropy. We were established 15 years ago and have supported innovative grant-making, public policy research, technical assistance, and convening to achieve our mission, which is to improve the health of the people of Connecticut. Since the foundation was established, over $52 million in grants throughout the state. In this infographic, you'll see the Foundation's plan to work toward expanding health equity for people of color in Connecticut, and this is our health equity roadmap. Last year, the Foundation shifted from a focus of eliminating health disparities and improving behavioral health and oral health for children to a focus on expanding health equity for people of color. Our approach to expanding health equity is simple and clear. We will leverage our resources and relationships to help people get enrolled and stay enrolled in an affordable health insurance plan. Once we will help to show them how to navigate the healthcare system to get the kind of care that they need, when they need it. And this includes bringing care to where people are, including community health centers, school-based health centers, and hospital clinics. And finally, we want to make sure that providers are offering the kind of care we all want to receive. And that means care that's affordable, comprehensive, which includes mental, oral, and physical health, and accountable to the goal of improving health for all of us. In this slide, you'll see how the Foundation works toward expanding health equity, and we invest in 4 important areas. At the top of the chart, you'll see that we make grants to help nonprofits, coalitions, state agencies, and other key partners to work toward our mission. Moving clockwise, we invest in strategic communications to deliver our message and to influence key partners and decision makers. And then continuing clockwise, we utilize our resources to support public policy to bring about change both within and outside of health systems. Specifically, we support advocacy and public policy research to change systems. And last but not least, moving along the chart, we realize that in order to foster long-term change, that we need to invest in the development of leaders to expand health equity in our state. Through our Health Leadership Fellows program, which is entering its 10th year, we have developed 180 Health Leadership Fellows since we launched the program back in 2005. And in this slide, we are using a really popular and well-known proverb to help explain how the Connecticut Health Foundation works to support systems change. I'm sure you've all heard the saying, if you give a man a fish, he will eat today. But if you teach him how to fish, he can feed himself forever. Unfortunately, it doesn't work out quite this easily. So some questions that we ask are, where does the man fish? Who else is allowed to fish there? And how many fish should one person be allowed to catch? Are the fish safe to eat? Also, who oversees all of this to make sure that everyone caught to fish has a fair shot at catching good, healthy fish to feed him and his family? So in this next slide, we take that fish proverb and we use it to help explain what systems change is. So first, when you look at systems, it's really about the interaction of people plus places plus rules. And what is systems change? First, we look at people who make the rules and set the priorities, and the people actually influence them. Now, when we look at places, we're looking at both this term in literal and symbolic terms. Places are where decisions are made and also where health care is delivered. And then the rules make the system run, and that includes laws, professional standards, procedures, regulations, and unwritten rules as well. So the Foundation's approach to systems change is really about investing in the right people, opening up places, which means access and transparency, and also rewriting the rules, especially when those rules are negatively impacting people throughout the healthcare system. So now I'm happy to turn over the presentation to what you've all been waiting for, which is to learn more about requests for proposals. And I'm happy to turn the presentation over to Joanna Douglas.
Good afternoon. So I'm really excited to be able to talk about this RFP today. We've done a lot of work in the state and supported oral health advocacy. I'm sure that many of you are familiar with COHI, the Connecticut Oral Health Initiative, and we have supported their advocacy work for many years, and we're very proud of the work that they have done. But we also realize that for oral health advocacy to have long legs, it needs to not only reside within those who are expert within oral health, but it also needs to reside within those who are advocating for health and issues for people in general. And so the essence of this grant opportunity is to broaden that base of advocacy for oral health into organizations and advocacy organizations that may not have had oral health. It may have been on their radar screen, but they may not have had the time or the funding to really get into it, to know about it, and to really insert it into their everyday programming and advocacy work. And that's really the overarching goal of this RFP, is to enable other organizations to really imbibe oral health and to make it part of their work along with the other important work that they do. And so one of our important pieces that I have up here, which is at the bottom of everything, is we're looking for non-teeth people to do this work, okay? So take that and run with it, non-teeth people. We're looking for very specific organizations, and so we really spelled out the eligibility in this RFP very carefully. We want you to have successful organizations, to have capacity and history of general health advocacy. In other words, we want you to have expertise of what it means to be in the arena of advocating for policies, legislation, but also to have contact with consumer and grassroots people and to know what it is they're asking for and what they need. We're looking for groups that have participated in supporting policy and administrative change to improve healthcare advocacy, healthcare access, i.e., you know what it's like to be in that playing field. You can mobilize stakeholders, including consumers. So you have a real-life contact and touch with the people in our state that need change. And that you can utilize opportunities and events to increase the visibility of oral health access and challenges. And this is a really important one, because I think often it's hard for oral health people to be in all the different places at once that oral health should be brought up at. Often it gets sidelined and we forget about it, but with other people at the table, bringing oral health into the conversation where general health is being talked about, oral health will become much more visible and much more integrated with the health conversation in general. So what are the objectives in the RFP? I've just summarized them here a little bit briefly here just to review them. So we want our successful applicants to be able to coordinate and collaborate among different community and system partners, including non-traditional alliances, in support of oral health access. Where are all the different places that you can think oral health could suddenly be integrated in or have a conversation about? We want to be able to, as a organization, as a foundation, we want to increase the number of advocates who are working for improved oral health access and quality. And we're thinking about not only legislators, but consumers and even health providers. And we want to increase the responsiveness of advocates to unique opportunities to bring attention to oral health access. And lastly, we want an oral health advocacy agenda that is both defensive, i.e. protective, because sometimes we do need to be reactive to protect what we have, But also forward-moving. What are the larger policy goals we should be working towards? So those are the board objectives. And you must, as an applicant, address all 4 objectives. That does not mean that you are solving oral health access for everybody in the state, but it means within your piece of the world, how can you address a piece of each of those 4 objectives? So a little bit about nuts and bolts. The funding level is up to $40,000 over 2 years. You can divide that how it makes sense for your organization, but I want to be clear, it is a total of $40,000 over 2 years, okay? It is not $40,000 for 1 year and then $40,000 for the next year. It is not that. It is a total of $40,000. When you do your application, we only need a detailed budget for year 1 only. And one thing I really want to emphasize in this is this initiative is to be sustainable. This is to give resources to organizations to enable them to get onto that pathway of talking about oral health. How do they insert it within their organization? How does it become a part of what they do? This is not about hiring new people to do something for 2 years. This is about how do you bring oral health into your organization and your work in a sustainable and ongoing way. We realize that many of you, because you are not teeth people, may not have a large amount of expertise in oral health. So obviously we're expecting you to look around and partner with other resources across the state. And obviously there are many oral health partners you could partner with. And in the long term, I certainly am a resource of expertise as you move forwards down the road for successful candidates to help increase their oral health knowledge and capacity. So the timeline, so we're here today, July 8th. Your applications will be due on July the 22nd at 5 p.m. by the close of business. There are no exceptions to that deadline. The application must be complete and into the foundation office by that time. We then go, as is outlined in the RFP, we will do our internal review process and recommendations to our program committee and board, and there will be notifications of successful award on September 24th. The grant period will start October 1, 2014, and run for 2 years. We are often asked about, well, how do we evaluate a successful applicant? What is the process that we go through? And the best way I can summarize this is we take the RFP, the questions and the things that we have outlined in there, and then we look at your applications, and we are looking to see that the applications are completely responsive to the questions and the areas we were concerned about in the RFP. And I'll highlight a couple of places for this particular application that I think are important. One is that you clearly demonstrate that you have met the eligibility criteria. We are looking very specifically for those organizations that can fulfill those eligibility criteria. We are looking for you to really clearly tell us how you're going to successfully achieve the RFP objectives. I think also, hang on a minute, I'm just going to some extra notes I put down here for you guys. Oops. Ding, 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 ding. In the outline of the RFP and the components, one of the first sections that you need to be responsive to is the need for oral health advocacy. This is section A that you'll be writing. And I want you to think about this, about writing this from the perspective of the population you represent, because you're not going to suddenly become the whole statewide oral health advocacy organization. That's not what this is about. This is about how does your organization and your section of the population need oral health. So how can you represent your population that you work with? including the population's voice is really helpful here, is it shows us who is your target population, what do you understand their needs to be, what have they come to you and told you about in terms of their oral health needs. But you also need to show that you understand the broader level of the policy picture at that higher level, that you can connect higher level policy with grassroots needs. So that's a big piece about the need for oral health advocacy and what we will be looking for. One thing in that section that we are not looking for, this is not a grant about going out and suddenly providing education for a group of people about oral health. Okay? That might be a small piece, but this is really about advocacy within your organization and nurturing the links you have to bring oral health advocacy into your work. We talked about applicant qualifications. That is very, very important. And this section helps us understand whether you have the tools to do the work. And I talked about the objectives, and then the last one of the next pieces is the proposed method. And we really want specifics. How are you going to do this work? And one of the best ways I describe a successful method section is if you took that method section and gave it to your friends, partner organization, would they be able to carry out the RFP? That's a good method section. Not that you know what it is, but that your neighbor down the road could actually carry out the RFP for you. Next slide. I think that was the end of our fairly fast and brief overview. And now we're going to open it up for questions from the chat box. And they're just figuring out how to do that over here, so just bear with us a second. Okie dokie. And right now we don't have any questions. We could open it up to oral questions on the phone because you're not muted. So if you do have any questions, we'd be happy to entertain them.
For people who have questions, if you could just introduce yourself with your name and your organization. Are we to interpret this silence as that we've given you all the information you need and we're very clear and you know exactly? Hello?
Hello.
Hi.
Yes,
Hi, do you have a question?
Oh, no, I do not. Thanks. I was just listening in.
Okay, okay.
Thank you.
Okay. So I just wanted to ask again, if anybody on the call has a question, if you could unmute your line and introduce yourself and ask your question or while you have us here on the line.
Yes. Sorry, I apologize for being so late. My name is Eliana Cardeno. I am also with Central AHEC. I believe just saw us already on the line with the same organization as I am.
Great. Do you have a question?
I don't. No.
Oh, okay.
Thanks.
Well, thank you for introducing yourself. Thanks for joining us today.
Thank you.
So if there are no questions, what I'd like to propose, and we're going to move it to the next slide, is if after what you've heard today and you've had a chance to process. Okay, we have a question. Okay.
This is Jen. I'm going to read it. Can you tell us more about how you define education programs? Do you mean for the population or the other systems?
I think what we're meaning, well, in some ways it's best to describe what we're not looking for. And Yolanda's going to tip it too because she's answered this question a couple of times. Is we're not looking for a program that says, you know, I serve population A, I'm going to go out and teach them about oral health. That's not what we're looking for. Yolanda, chip in a bit.
Right. So the other thing to be really clear about is if education is a part of your oral health advocacy strategy, then we need to understand how you would actually incorporate education as part of your strategy, but it really has to be the project that you're requesting funding for really has to be about advocacy. And we understand that education is a piece of that puzzle, but it just can't be solely about education.
Another way of thinking about it would be, or one way I like to think about education is, how does education fit within the systems change model? Because what we're about here is how do we change systems. So I certainly could see that education about oral health could be a really important piece for your employees within your organization, so that they go out equipped and ready to work with the populations that they already work with, or are able to carry on conversations at the legislature. That is a place where I could see education as a piece of your strategy, because it is arming your advocates with the information necessary to engage in systems change conversations. Does that help out there, Robin? Yes. Excellent. Thank you.
Are there other questions for Joanna or for me?
Hi, this is Diane Stroman from Team Incorporated in Derby, and I don't see in the application any type of guidance regarding the number of towns, whether or not this is a regional application or if it's just based on each person submitting and saying what towns they are going to serve. Could you give some feedback on that, please?
Sure. So we understand that this is a limited grant opportunity. We don't have a large pool of dollars for organizations to fund the work of applicants, but we are interested in seeing applicants explain the geographic regions that they'll be targeting, whether that's your city, whether that's a regional focus, or whether it's a statewide focus. And it really depends on the organization and your footprint and where you already do your work. So it would be great if we had some really good geographic representation among the applications, but it really depends upon the organization and the target population that you serve and the geographic area that you serve.
I think one of the things, I'm going to look at Yolanda to see if we're on the same page, because some of these questions come up when we look at each other and go, I haven't had that one before. I think I totally agree with everything Yolanda's saying, and I think, too, it goes to number of people served, and also because this is systems-wide change, and we look at the whole state as it can't just be one small town that you are serving. You don't have to be statewide, absolutely not. But if you're only serving a town of 1,000 people, that would be a challenge for us, because we are an organization that change at a statewide and systems policy level. So there's a gradation there. We're not expecting everybody to be completely statewide or whole region-wide, but obviously we can't look at something that is very, very small focused. That was a fuzzy answer, I know that.
Thank you for your question. Are there other questions from any of the callers? Okay, well, hearing no further questions, Joanna, Jen, and I would like to thank you for joining us for today's webinar. And my contact information is on the screen. You can reach me by email or phone if you have additional questions. And I just remind everybody that the deadline for applications is July 22nd by close of business at 5 o'clock. And I'd like to thank everybody for joining us today.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.